I'm Dr. Hazel D with the Centers for Disease Control and Prevention, or CDC, and an alumna of Spelman College. This is an installment of the Atlanta chapter of the National Alumni Association of Spelman College's health program called 5 Minutes for Your Health. Today's topic is COVID-19. I will explain what the disease is, answer some of the common questions on COVID-19, and discuss steps you can take to help protect yourself and others. The first question that many people have is, what is COVID-19 and how is it spread? COVID-19 is a disease caused by a virus called SARS-CoV-2. The disease can cause symptoms ranging from mild to very severe, and most often causes respiratory symptoms that can feel much like a cold, flu, or pneumonia. COVID-19 spreads when an infected person breathes out droplets and very small particles that contain the virus. These droplets and particles can be breathed in by other people or land on their eyes, nose, or mouth. In some circumstances, they may contaminate surfaces they touch. Anyone infected with COVID-19 can spread it, even if they do not have symptoms. Symptoms may appear 2 to 14 days after exposure to the virus. COVID-19 can affect anyone. There are several steps you can take if you think you have COVID. If you have COVID-19, you can spread it to others, even if you do not have symptoms. If you have symptoms, get tested and stay away from others, even at home, until you have your results. If you find out that you were exposed to someone who has COVID-19, you should wear a high-quality mask or respirator, such as an N95, when indoors around other people, including at home, for 10 full days, and get tested at least 5 days after your last exposure, even if you don't have symptoms. If you have tested positive, even without symptoms, you should stay home for at least 5 full days and isolate from others in your home. You are likely most infectious during these first 5 days. If after 5 days you are fever-free for 24 hours without the use of medication and your symptoms are improving or you never had symptoms, you can end your isolation. You should still wear a mask through day 10 and avoid being around people who are more likely to get very sick from COVID-19 until at least day 11. If you have access to home antigen tests, you should consider using them. If you have 2 negative tests in a row taken 48 hours apart, you may remove your mask sooner than day 10. Effective treatments are not widely available and free, and you may be eligible. Contact your healthcare provider, health department, or community health center to learn more about treatment options. Don't delay seeking treatment. Treatment must be started within a few days after you first develop symptoms to be effective. Another question often asked is, why is it important to stay up to date with COVID-19 vaccines? COVID-19 vaccines add an important layer of protection to keep you and your family safe. Staying up to date with your COVID-19 vaccines lowers your risk of getting seriously ill, being hospitalized, or dying from COVID-19. CDC recommends that everyone who is eligible get a booster and stay up to date on their COVID-19 vaccines. Many viruses are constantly changing, including the virus that causes COVID-19. These changes occur over time and can lead to the emergence of variants that may have new characteristics, including different ways of spreading. The emergence of COVID-19 variants further emphasizes the importance of vaccination, boosters, and prevention efforts needed to protect against COVID-19. You can visit the website vaccines.gov to find locations to get a vaccine or booster for COVID-19. You can check CDC's COVID-19 Community Levels website to help you decide which prevention actions to take based on the latest information. Each level helps convey how much COVID-19 is impacting your community using data on hospitalizations and cases. Using these data, communities are classified as low, medium, or high. For each level, CDC recommends actions you can take to help you protect yourself and others from severe impacts of COVID-19. For more information on COVID-19, speak with your healthcare provider, call your local health department, or visit cdc.gov. This concludes this session of 5 Minutes for Your Health.